You're listening to Montreal Now with Aaron Rand and Natasha Hall on CJAD 800.
All right, that is James Mennie. He is out at the Montreal Gazette. And Jim, the major changes in our health network have begun. Yesterday we had the big news conference, press conference held by Christian Dubé, which basically told us nothing. And then today, the big news, of course, a transition committee. Wow, this is really earth-shattering news.
Yeah, listen, and just we're on the topic of Quebec healthcare. I just want our listeners to know that clip we heard of Louis-Alexandre Taschereau back in the 1920s urging Americans to respect French Canadians who got down in the States to work. The last 40 seconds of that clip, he's actually saying, and also please avoid using emergency rooms in Quebec for the time until further notice. But yeah, this is where we are. We're just I can't believe that so monumental a transition, a plan, a reform, call it what you will, is we're going into this completely blindfolded. We don't know. We know they want to get a lot of private help, a lot of private managers in there, presumably because of the rather dangerous mentality that, the private sector does everything better than the public sector. I guess if the price is right, yeah, and we see how high the price is going to be, certainly for the CEO of Santé Quebec. But, the Bill 15, the actual title of that law is an act to make the Health and Social Services Ministry more efficient. And I have not heard one single thing that is going to address any of that, making it more efficient. Indeed, having people who are coming into ERs go someplace else. It's all of it extremely vague. All we know is that change is coming down the pike. We're trying to hear from as many voices as possible, which is a hallmark of Quebec democracy, which is you bring in all the actors involved in this, you listen to what they have to say, and then you totally ignore anything they told you that goes against your plan. And the report from this committee is supposed to be ready by April of next year. I wonder how far we're going to get between now and then, especially if this committee is supposed to be putting together progress reports every 4 months on what it's doing or what it intends to do. I know that Christian Dubé said he was going to shake the foundations of the temple. I think that temple is very, very rocky. It's very solidly built. And I'd be careful with Mr. Dubé that I don't knock my head against a very hard wall when it comes to these broad changes that you're suggesting. Although details, we have to wait for that. It's all very, very dicey as far as that.
So I'm looking at the list of 11 names making up this transition committee. Anybody you saw there that struck you as, that's a great choice? Because everyone here seems to be involved in one way or the other already. I'm not seeing anybody from the outside coming in here.
I saw a reference to a physician whose name escapes me at the moment. There's someone who was critical of Bill 15, and I believe she sits on a users committee. And there was also it may have been updated, excuse me, I haven't seen it so far, people who were described as former government administrators. So we'll see where that's going to lead. But once again, when you look at how much we spend on healthcare in this province, when you look at how much attention we pay to it, to go into this major reform, and remember, this law was adopted with closure. Debate was cut off, even though we have to get started on this. We don't know. I mean, maybe the CAC knows what they're doing, but by and large, Quebec doesn't know what changes are going to be wrought to this healthcare system, and indeed whether those changes will be for the better. Is this a matter of a bean counter approach? Let's face it, the Premier of Quebec is an accountant. Is this a matter of cutting costs? Maybe ostensibly people will say, yeah, that's a great idea. Let's save some money here. But what happens if the service, which is already kind of sketchy in certain regions of Quebec, deteriorates even further in the interest of limiting costs? We tried this a few decades ago, the PQ under Lucien Bouchard, you may recall, getting rid of, basically offering all these nurses, take your early retirement, get out of here, we have to save money. And then a couple of years later, we were shipping cancer patients to Plattsburgh for chemo. Yeah. So, I just wish this glorious roadmap had a little more in the way of detail and a little less in the way of committee meetings.
I just find it nonsensical that when we know bureaucracy is such a big part of the problem here, that we're trying to fix the problem with yet more bureaucracy.
That's kind of how it works, huh?
But here's the thing. If it was a more efficient bureaucracy, fine, I guess. Mm-hmm. And I've heard, what we might be getting rid of some deputy ministers, which might be, a saving in terms of payroll. But I don't know. I haven't got a clue what they intend to do to the hospitals that I go to, that our listeners use, that Quebecers use. I haven't got a clue about what the work schedules or the workload for the people in the healthcare system now who are already at the end of their tether, whether that's going to be improved or whether, as some leaks suggest, any manager can tell you where you have to work within a particular region. And if you don't like it, too bad. That's what Mr. Legault wanted when he said about more flexibility. And the problem is that might work in say, the region of Montreal, which is relatively manageable geographically. Mm-hmm. But when you're in the Kootenai, when you're out in the Gaspé, there's a bit of a distance between, say, one hospital and another. How easy is that going to be for employees to address? Maybe it will be. Maybe there's a plan. The problem is we don't know what it is.
All right, let's move on to talk about something else today, because you're suggesting it wasn't really necessarily – actually, you're saying if it wasn't for bad news, the Liberals would have no news at all. What happened today, Jim? Did I miss something?
Well, no, but basically Abacus put out another survey, and even though there was a bit of a blip last month, that the federal Liberals under Trudeau were only, he said, making air quotes, 10 points behind the Conservatives. They have resumed their usual place, 17 points behind the Conservatives. The Conservatives are polling 41% nationally. They are crushing the Trudeau Liberals in Ontario, where elections are won. And the federal Liberals, are hanging on by their fingernails. They're trailing the Bloc Québécois. They're maybe 3 points ahead of the Tories in Quebec, which is completely unheard of. And they're maybe 4 points behind the Bloc Québécois. In other words, maybe they'll survive in an election, but that's the only place where the furniture is not going to be swamped. Right now, and these are not outliers, guys. This is a total pattern for the federal Liberals. And the other thing, we were talking about Denis Coderre yesterday, and I'm sorry. I mean, I don't mean to use this expression lightly, but talk about damning the provincial Liberals with faint praise. People are saying, well, if nothing else, it's really good news that Denis Coderre says he's interested in leadership because people might actually start paying attention to the provincial Liberals. Let that one sink in for a second and tell us where we've come from with a party that at one point used to share power for 50 years running this province.
It's pretty pathetic.
You're right, though, isn't it? I mean, I heard Desiree McGraw basically say the same thing today when David Hertel asked her that question, saying, well, this will shine a light on the party, and that's a good thing.
Get people talking.
Yeah. Wow.
There's no such thing as bad publicity. I got news for you.
Yeah,
there is.
Maybe in the case of Denis Coderre, there is. I don't know. I'm curious to see, Jim, how much of a, I guess, this continues in terms of, now that Denis Coderre is weighing what people have said over the past couple of days, how much of that sort of goes into his plan to keep dropping little nuggets to suggest, yes, he's interested, and yes, he's going to do this, and yes, he's going to do that. Are you thinking that's likely to happen?
Well, it may. I mean, clearly this is not happening at random, but I'm really interested in seeing if this other theoretical development, which is, well, once he's in there, other people will develop an interest and they'll start making noises about going for the leadership. Well, what happens if all you hear is crickets? What does that say?
Yeah, good point. James Mennie, he is over at the Montreal Gazette. Jim, thank you.